Hey guys, Dr. Jeff here. In this video, we're going to talk about one of the biggest questions we get when patients come into the office. Why do I still have lower back pain? And there's really some common things that we notice, and a lot of times people are missing as to why they have chronic back pain or they've been struggling for weeks, months, or even years in some cases. So let's dive into those. Number one is, I always tell patients the pain location does not equal the problem. We have a lot of people that when they first come in, they have lower back pain and they've done physical therapy, chiropractic, massage, ice and heat, they've done stretching, they've tried everything for their back. And they've been working very hard in this region, okay? But I always remind patients, where you feel the pain is not always where the problem actually started. A great example is when somebody has a heart attack, right? Your heart is failing, you have a clogged artery, but what happens is a lot of times you'll get pain in your left arm or your left jaw. If those doctors treated your left arm or jaw pain, you'd be dead pretty quick. So the goal is not necessarily just to find, right where the pain source is. We have to remember that the entire spine is a functional unit that works together. So a lot of lower back cases can actually be caused by neck issues. Another frequent source of it is knee or feet problems or imbalances. Why? Because the knees and the feet are the foundation for the hips, which is the foundation for the back. Okay? So remember, the body is a kinetic chain. It's not parts that you just piece together. It all functions to create a healthy system, or is dysfunctional to create an unhealthy system and back pain, right? So check everything. That's step number one. Step number two is we have a diagram here. This is of the neck, but we just want to talk about the factors involved in back pain, right? So you can see we have spinal bones, and then these tubes, these yellow tubes, these are the nerve roots. Now the only thing this picture is missing is the muscle. Okay, so muscle will surround both sides of the spinal column in different angles, and it allows the spine to move, turn, and it also creates stability and strength. Okay, so there's three components. There's basically nerve, there's bone, and then there's muscle, also called soft tissue. Okay, muscle, disc, tendon. Now the way that these systems work, this is pretty critical here, is the nerve will innervate the muscle. So nerve is what allows our muscles to contract, to relax, and it tells them how much tone or tightness to have. The muscle attaches to and surrounds the bone and spinal column. So this is important because that's what allows normal movement, normal function, and stability. And then finally, the bone basically creates a column that protects the nerve roots, right? And if we have a disruption in that column, it can then cause irritation to the nerve roots. So the bone is supposed to protect the nerve. Now, I always remind people this works in a cycle, over and over again, every single minute of every single day. And a lot of times what happens is when people go to therapists or doctors, they'll treat one area. They'll treat just the muscle, or they'll treat just the bone, or a lot of times, nerve and muscle. The problem with that is if you're only addressing one component, is it will short circuit the cycle. You'll feel better temporarily, but if you don't fix all three causes, if that's the case, the cycle will then come back and continue. So really the main goal is, in the initial exam, you have to find out which of these are involved. Typically it's all three. A lot of times it's two, very rarely is it just one problem. Why? Because they interface together. So make sure when you go and see your doctor, all three of these are being hit, because it's critical to get a lasting correction versus just temporary relief. Now the final part is, what's really the goal? There's a lot of different types of doctors out there, and that's good, we need that. But you want to remember, what is your end goal? Are you looking for a method to just mask the pain, or are you looking for something to actually fix the pain? Because the treatment for those two is completely different. If you're looking to mask it and you're taking medications or biofreeze or ice packs or cortisone injections, a lot of times that will help to reduce pain. And there's nothing wrong with that. If people are in a lot of pain and they need to get out of pain, that's important. But I always remind people, really the long-term goal is to not want to be reliant on these, is to find and fix what is the actual cause, what is the actual source, so that I can get a lasting solution without having to be reliant on medication or reliant on injections, or just living with back pain, which is the worst case scenario. So I hope this video helped you a ton. Remember, if you're struggling with lower back pain, there's a lot of different things that you need to look at outside the box to make sure it's getting addressed properly so you get a lasting solution. As we always say, don't fight the pain, fix the problem. Thanks for watching.